Today I will be talking about breast cancer. But before I get into the details, I will define cancer. Cancer is defined as uncontrolled growth of a group of cells which disregard the normal rule of cell division. The cancer is named based on the organ in which this abnormal growth is taking place. For example, if the abnormal growth is taking place in the lungs, it's called lung cancer. And if it's taking place in the breast, it's called breast cancer. Under normal conditions, cells grow, divide, and replicate under the supervision of genes. Therefore, certain genetic defects will result in abnormal growth and the multiplication of the cells. The abnormal growth of the cell is known as hypertrophy, and the abnormal multiplication is known as hyperplasia. It is also important to know that abnormal cells can affect good cells, which is a process known as carcinogenesis. In the normal process, the normal cell will grow, mature, and replicate into like cells of the organs. This process is known as meiosis. Mature cells will divide into two or more daughter cells with the same genetic material. There are three main functions of cell division. The first one is the reproduction of an entire unicellular organism. The second one is the growth and repair of tissues in multicellular organisms. And the third one is the formation of gametes, which are eggs and sperm, for sexual reproduction in multicellular organisms. If anything goes wrong with the genetic control, the growth and replication of the cells become abnormal. In addition to the organ in which the cancer cells are growing, the histology of the cell or tissue is also important. There are only 4 types of cells or tissues in the body. The first one is epithelial tissue. The second one is connective tissue. The third is muscle tissue. And the fourth is nerve tissue. If the cancer arises from the epithelial cells or tissue, it's called carcinoma. This type of carcinoma may either be squamous cell carcinoma or adenocarcinoma. If the cancer arises from the connective tissue, it's called sarcoma. Example, if it's the bone, it would be osteosarcoma. And if it's the cartilage, it's called chondrosarcoma. Cancers of muscle tissues would also fall under connective tissue. An example is rhabdomyosarcoma. Blood is also connective tissue. If the cancer arises in the blood, it's called leukemia. If it arises in the plasma cells, it's called myeloma. And if it arises in the lymph nodes or lymphoid tissue, it's called lymphoma. Skin is also a connective tissue. Cancers arising from the skin are melanoma, basal cell carcinoma, or squamous cell carcinoma. Finally, if the cancer arises from the nerve tissues, it's called glioma. The most common cause of death in the United States is coronary heart disease. This is followed by cancer. The most common cause of cancer death is lung cancer, followed by breast cancer, prostate cancer, colon cancer, and pancreatic cancer. Now I will turn my attention to breast cancer. Breast cancer can be classified as invasive breast cancer, non-invasive breast cancer, and breast cancer with estrogen receptors, progesterone receptors, or HER2 receptor positive, and also can be negative. So there are three classifications that we need to be familiar with. Again, invasive, non-invasive, and receptor positive. Here is a schematic of the breast. Here we have the chest wall, the blood vessels that supply the breast, the mammary glands or ducts, and everything is coming towards the nipple, and the breast is filled with fat cells, and of course the underlying muscular structure. Let's talk about invasive breast cancer. Invasive breast cancer. The first type of invasive breast cancer is invasive ductal carcinoma. That's invasive ductal carcinoma. Invasive ductal carcinoma, or ICD, starts in the milk ducts and then spread to the surrounding tissues. This is the most common form of breast cancer and accounts for about 75% of all breast cancers. The second type of invasive breast cancer is invasive lobular carcinoma. That's invasive lobular carcinoma. Invasive lobular carcinoma, or ILC, is a cancer that starts in the breast lobules and invades surrounding tissues. Invasive lobular carcinoma is the second most common form of invasive breast cancer, accounting for about 10 to 15% of all breast cancers. The third type of breast cancer is inflammatory breast cancer. Inflammatory breast cancer. In this cancer, the breast can appear red, swollen, and tender with varying degrees of deformity, which may include the nipple. It is the cancer that's causing the inflammatory reaction, which can also block the lymphatics and result in an edematous breast. Inflammatory breast cancer can spread very quickly. The fourth type of invasive breast cancer is breast sarcoma. Breast sarcoma. In this form of cancer, the tumor is invading the connective tissues surrounding the lobules. It is very rare and accounts for 1% of all cases. The fifth type of invasive breast cancer is metaplastic carcinoma. That's metaplastic carcinoma. This is also a rare type of invasive breast cancer in which two different types of cell are identified in the tumor. And so this is important to recognize that in metaplastic carcinoma, even though it's very rare, there are two different types of cancer cells that would be identified in the tumor. Now let's talk about non-invasive type of breast cancer. Non-invasive type of breast cancer. The first one is ductal carcinoma in situ. Ductal carcinoma in situ starts in the milk ducts and remains in the milk ducts. However, some do become invasive. It is the most common non-invasive breast cancer. It is also abbreviated DCIS. So non-invasive ductal carcinoma in situ can be classified as low, intermediate, or high grade. The grade is based on how close the cancer cells resemble normal cells. A low-grade DCIS means the cancer cells closely resemble normal cells. On the other hand, the greater the difference between the cancer cells and normal cells, the higher the grade. The next non-invasive breast cancer is lobular carcinoma in situ. Lobular carcinoma in situ, abbreviated LCIS. In this case, the abnormal cells are in the lobule, where the milk-producing glands are located. Lobular carcinoma in situ is not considered to be a true cancer because it does not become invasive. A similar condition is atypical lobular hyperplasia, abbreviated ALH. Both conditions, that is both LCIS and ALH, are non-cancerous and are due to lobular neoplasia. So far, I have talked about invasive and non-invasive breast cancers. Now I want to talk about the cancers that have receptors and those without receptors. Breast cancers can have three types of receptors. They are estrogen receptors, progesterone receptors, and HER2 receptors. Cancer cells can either be estrogen receptor positive or negative, progesterone receptor positive or negative, and HER2 receptor positive or HER2 receptor negative. It is important to understand that if the cancer is receptor positive, the cancer will grow more aggressively but will respond better to treatment because they can be treated with hormones. On the other hand, if the cancer is receptor negative, the growth may be slow, treatment is more difficult, and the cancer is more aggressive. Then there is what is known as triple negative breast cancer. Triple negative breast cancer. About 10 to 15% of breast cancers are classified as triple negative because they lack receptors for estrogen, progesterone, and HER2. These cancers are more aggressive and are more difficult to treat. The next thing I want to mention is the biomarkers. We have the BRCA1 and BRCA2 gene mutation, which gives a strong indication that someone will get breast cancer. What is breast cancer screening? Studies have shown that regular annual mammography screening of women with no symptoms of breast cancer has lowered the number of women who die from the disease by about 30%. Women between the ages of 25 and 40 should have an annual clinical breast examination. Women 40 and older should have an annual mammogram in addition to an annual clinical breast examination. Ultrasound may be recommended for women with dense breast tissue. All women should consider performing a monthly self-breast exam beginning at age 20 and become familiar with their breasts so they are better able to notice changes. The screening continues for women with a history of breast cancer. In such a clinical breast exam should be done every 6 months, starting no later than 10 years before the age of the earliest diagnosis in the family, but no earlier than age 25 and no later than age 40. An annual mammogram starting no later than 10 years before the age of the earliest diagnosis in the family, but no earlier than age 25 and no later than age 40. Also, a possible supplemental imaging with ultrasound for women with dense breast tissue could be performed, and also alternative breast MRI or mammogram should be done every 6 months as determined by the physician. The next category includes women who have been diagnosed with atypical hyperplasia or lobular carcinoma in situ. These women should have a clinical breast exam every 6 months or every 12 months, and that should begin at the time of the diagnosis. Also, they should have an annual mammogram beginning at the time of diagnosis also. And there should be possible supplemental imaging with ultrasound for women with dense breast tissue. For women with genetic predisposition to breast cancer, they should have a clinical breast exam every 6 months. And definitely they should have an annual mammogram starting at age 25. And also that should be followed up with an annual breast MRI. Now let's talk about signs and symptoms of breast cancer. In many cases, symptoms may go unnoticed until it becomes severe and may include the following. Number one, there may be a lump or a mass in the breast that feels different from the surrounding tissue. Number two, there may be changes in the shape, the size, and the appearance of the breast. Number three, you may have a discharge from the nipple. Number four, there may be a breast rash. Number five, you may have changes in the skin over the breast. For example, dimpling. Number six, you may have breast pain. Number seven, the nipple might be inverted or be pulled in, otherwise described as a retracted nipple. And then the skin might be scaling or peeling, or there may be flaking of the skin over the breast, particularly the area around the nipple. And finally, there may be redness and or pitting of the breast skin that resembles the skin of an orange. Just want to emphasize that the dark area around the nipple there can be a dark area around the nipple, and when compared to the unaffected breast, this dark area is extremely dark, in addition to the retraction of the nipple. Now let's talk about the Tnm staging. Tnm staging. T represents the tumor size, N represents the nodal involvement, and M represents metastasis. So the Tnm staging indicates the tumor size, whether or not the cancer has involved the neighboring nodes, and whether or not it has metastasized. T0 means there is no evidence of tumor. T1 to 4, right, that range means the tumor has grown into the nearby tissue, and it also describes how much it has grown. N0 means there is no cancer in the lymph nodes. N1 to N3, again, it's a range, describes the cancer being spread to the lymph nodes and the amount of nodes involved. And M0 means the cancer has not spread. There's no metastasis. However, M1 means that there is metastasis. The last thing we want to talk about is the treatment. And there are many treatment options for cancer, for breast cancer. These treatment options are dependent on whether or not it's invasive or non-invasive, and whether or not the cancer cells are receptor positive or receptor negative. All these factors would determine the treatment modality that the oncologist would incorporate. However, as a general list, the treatment choices would include hormone therapy, chemotherapy, radiation therapy, surgery, and radiosurgery. Hormone therapy would be applied to those cancers that have estrogen receptors, progesterone receptors, and HER2 receptors. And these cancers they respond much better to hormone therapy because with hormone therapy, the receptors can be blocked. Hence, it can speed or increase rather the process of remission. A person who gets hormone therapy might also be treated with radiation. A person who gets chemotherapy is a person in whom most times the cancer has metastasized, and obviously you can't radiate the entire body. So chemotherapy becomes more useful for persons with cancers that have metastasized from the breast. Ladies with non-invasive ductal carcinoma or lobular carcinoma, non-invasive, they can be treated with surgery and radiation. Surgery and radiation. And there's another modality of treatment, which is the radiosurgery, which does not employ conventional surgery. It does not employ the radical mastectomy, but it is a modality that uses a type of radiation that specifically targets the cancer cells. There's no cutting involved, there's no bleeding, and just few oncologists are involved in this type of treatment. So these are all the treatment options. By no means this exhausted, because there are a combination of any of the above can be used based on the type of cancer that the person has. And just as a note, both male and female can also end up with breast cancer. It's not just a female phenomenon. Males also can be subjected to breast cancer. Well, I hope this short presentation did help in your review of breast cancer and has cleared up a few points for you. Thank you for watching. Please share, like, and subscribe. I wish you well. Good night.